Yeah. And of course, they put you probably like the closest to your gate.
Right next to the gate, yeah.
Right there, so
Yep.
any bathroom's gonna be at the very end.
Yes. Yeah, I had never, that's the first time I had a wheelchair service, and I never would have figured that. So I learned something.
Maybe I have to get right there.
And I won't be
Okay. You're on, Audrey.
anybody.
You're live.
Okay. So,
Yeah. I don't like tea party.
we meet today, so I don't know if we're gonna get any other, club members in person. But, on camera now. So we record, and broadcast it onto YouTube Live, so if there's anybody who can't make it in, they can watch it, from home, or we also record it, so it's on there, so other people can watch it later. Today, we were hoping to have a group discussion with you four are from ICOM, and these two in the end are patients. And then Tara and I are both respiratory therapists, and we were hoping to have a group conversation about effective communication between provider and patient. So, you guys want to introduce yourselves? We did a little bit earlier, but I think we're
I'll start. I am Victoria. I'm a second-year medical student at ICOM.
I'm Michaela. I'm also a second year.
Jessica, also second year.
I am Matthew, I'm also.
And you guys are the pulmonary interest group.
Yes.
Awesome. So we want to shape you up right to what our pulmonary patients are, what they're feeling. So a lot of times our patients say that they talk to their doctor and their doctor didn't have enough time with them, or didn't answer their questions, or answered it at a level where they couldn't understand. And there's plenty of other issues. So that's kind of what we're here to talk about. Do you want to start off with some things you've run into?
Absolutely, I would be delighted. Believe it or not, I actually really like physicians. I really love what you've done for me. I'm having my second hip surgery next month, so there's lots of things that I've been through, and I've had really good communication from some physicians and not good from others. And I'm going to be honest with you, my pulmonologist was one of the not so good. And I told you a little bit about my story, but I didn't know I had anything. I just thought I was old and fat and getting fatigued and tired all the time. And then I had a really bad, what I now know asthmatic event in the middle of the night where I could not breathe. Thought I was going to die. I mean, it was really, really bad. And the next day I called my physician, my personal physician, and I said, hey, I don't know what this is. I've never had anything like this happen before, but it scared the hell out of me. And she said, come on in, And she listened to things and did things. She goes, I think you've got asthma, and I want to send you down to have a pulmonary function test. And I'm going, okay, had no clue what it was. Okay, so I went and had a pulmonary function test. Found out in a very bizarre way that I had COPD. As per normal, the nurse person who did through the whole stuff didn't tell me, what the results were. They said, we send everything over to your physician so that my physician can explain it. Well, I had an expectation based on what my physician had said that I would hear from them in a couple of days. And I hadn't heard anything after 3 days. So I called the office and I said, hey, I was expecting some results and a communication about the test I did, the PFT. And the woman at the front desk said, let me take a look at your chart and see what we can figure out. And she goes, oh, it says here you have COPD. This is the receptionist telling me over the phone, oh, by the way, you have COPD. I don't consider that really good communication. That was not my doctor's fault. That was, somebody just didn't get back to the customer, as I always call myself, the customer. But that was really scary because the only thing I knew about COPD is people die. Seriously. And so I kind of went, like this, and immediately went to Google Okay, need to know all the things, and that is who I am. I'm gonna find out as much as I can. And so in finding out what it was, they went through, obviously got the appointment to see the doctor again. And they explained that you have COPD and probably some asthma too. But they couldn't do that chlorine challenge test because my COPD was at a level that they did not want to do that and tipped me over into an area that was not pleasant, so to speak. So we did all that, found that I have sleep apnea as well. And I'm at home looking at COPD Foundation because those guys have lots and lots of information. And so I'm just, wow. And they said, part of it said there's a genetic component as well. And I'm like, genetic component, COPD? My father died at 53 from emphysema. And I said, and that's pretty young. And I was like, so I went over to the Alpha-1 site and did the free test and found out I had Alpha-1. And then when I talked to my pulmonologist, I was told the reason that they didn't test me was because I had been a smoker. And because smoking imitates what happens with Alpha-1, what's the point of getting the test? And you've already heard this, and I apologize, you have to listen to it again. They never tested anybody that smoked. They said they tested people, but they never tested anybody that smoked. And the reason they didn't is because it created similar pathology. So it is what it is. And that made me really angry because it involves my family. You know, it is inherited from both sides. And so I was really upset to find out that because they made the decision that I didn't need to be tested because I was a smoker. To me, that told me two things. Number one, if you're a smoker, you're screwed anyway. So what difference does it make? That's the way it felt on the inside to me. And the other thing is that from my perspective is we're talking about my family, everybody that's coming after me, just as if my dad had known, he was dead before all this happened with Alpha-1 and they were, really was doing anything with it. So he wouldn't have known, but I could have known even earlier, and that's really frustrating and really made me angry, as she knows. And that's the kind of thing about making decisions for a patient that I really, really, really want everybody to know is that's not a decision that should be made. If there's a test, if there's there's results that affect more than just me, I deserve to know it. It's vitally important that my family understands that if you smoke at all and you have Alpha-1, you're putting yourself really deeper into that trench. If you choose a profession that gets you a lot of particulates, that's going to put you in a particular place. My grandkids now know that because I got myself tested. But only 1 in 6 people with COPD are tested for Alpha-1. So to me, that's a really, really strong, please keep that in mind as you go forward. That to me is just probably one of the most important things. And then I didn't see my pulmonologist or the PACs. What's that? The mid-level? The PA, yeah. After the first 6 months of going to my pulmonologist and having PFT tests done, all that stuff, I didn't hear from him again for 2 years. And I found out later that that's not necessarily the right approach to take. And after that 2 years, I hadn't heard from him again for another 2 years when I went to see an allergist because of all the other issues I was having. And the allergist was appalled that I hadn't seen my pulmonologist for 2 years. And I didn't even know I should have been appalled because I didn't understand, basically what do they call those, the gold standards. And So I read up on the gold standards, and the next time I saw one of the PAs, PAs, is that the right name? Okay. I talked to them about that, and they said, well, you're right, this should have been happened, it's just we had this, and this, because there aren't enough pulmonologists. And so you don't really see your pulmonologist. I've only seen him once. That was the very first time. That's also not great, but I have had some really good PAs. I've had some not so good, but I've had some good PAs. PAs were really communicated well. And I just think that patients don't know the kind of care they should be receiving in these situations. The first thing, if I were a physician, because I did customer service for years in retail, and I just consider me, a really good, I'm up there. I know about dealing with people. I personally believe that anytime you are diagnosed with what is considered a chronic and eventually life-altering disease, that somebody should sit down and set out some expectations for you. The first thing you see when you go online on Google is that COPD, you could be gone in just 5 years. So I immediately, of course, went out there and made a will, did my post thing, did the whole 9 yards, because I'm like, I don't know when it's going to happen, so I'm not going to be, behind track. I'm just, okay, we're going to do this, this, and this, and this. The physician, in my expectation, is that they would talk to me and say, hey, you're going to read a lot of stuff, but here's the real deal. This is what you can expect. It's individual, every person is different, but from where you are right here, if we can get you in normalized, stable with medicine, I take Trelegy, you should be this, and this. And there are things that you can do to help take care of yourself and prolong it. So that's really what I ask of physicians is be upfront, be realistic, be honest, and don't just assume that, we don't care about doing what we can do to help ourselves and learning more. Not everybody will. There are a lot of people, only one other thing, and then I'll stop. There are a lot of people, both individually, because I work in a peer group situation where I mentor people to take pulmonary rehab. And there are a lot of people that don't want to do that, or that are very hesitant to do pulmonary rehab because they have this guilt trip that they're the ones that got themselves into this because they're smokers. And from a peer group mentor perspective, it's sometimes really difficult to get around that, hey, yeah, we all made a mistake being smokers, but that doesn't mean that you have to pay for it with your life right now. That there are things that you can do, that it does help you turn around. It can help change your mental process, and that's really important. Unfortunately, some of the feedback that we get from professional physicians, PAs, except nurses even, is, the word smoker. It's literally like, they're just like, well, you idiot, why did you smoke? And from somebody who's old enough to have gone into a physician's office and watched them smoking, I think that's pretty goddamn stupid, excuse my French. I mean, I'm not saying I'm guilt-free, that I'm not, taking responsibility for my actions, but we don't need to be, because trust me, we've all done that enough to ourselves. It's tough to quit. And when you have quit, you're proud of yourself, and the last thing you want to hear is, well, you were stupid because you smoked. Well, yes, I know that, but I also quit. So being more upbeat about it, more empathetic, because everybody does make mistakes. We're not the Lone Rangers. I think that that's really important going forward in helping our clients, because nobody that's suffering from COPD needs to be beat over the head with the fact that they smoked. We're already doing that. We're really good at that. That's it.
Yeah. I have 3 big questions for you.
Yes.
And I'm going back all the way back to in the timeline of the story.
Mm-hmm.
Do you think that, going back to Alpha 1, do you think that a bigger thing that physicians should focus on is shared decision-making with their patients, more so giving patients the option of, hey, this treatment, this testing, genetic testing is available.
Mhm.
Perhaps this physician doesn't see the benefit because of that similar pathology, but just state all of those things. Say, the physician's perspective, but give the patient a choice ultimately. Is that what we're going for here?
I'm going to be honest with you, 100%. I would say that sounds ideal. However, I also know that anybody that's just been told that they have COPD doesn't want to hear anything else. It's already overwhelming.
Yeah.
I did because I had a family background. I would personally say, hey, listen, if you have had anybody in your family that has also suffered from COPD or asthma or any of that stuff, I need to let you know that there is a genetic component and that there are really good beneficial things, because there are, especially some really wonderful ones coming down the pipe that really can make a huge difference. So I would like to do this genetic testing just to make sure that if there's something else that we can be doing to help your situation, we know that that's a good point to run on.
Thank you.
You're welcome.
That kind of bounces into my second question.
Mhm.
Do you recall how the physician, the pulmonologist, once you actually got to see them, how did they explain the chronic disease to you, and what did you like or not like about it? Do you remember that discussion? Was it like overwhelming vocabulary? Were they pretty good on?
It wasn't, but that's because I have kind of a healthcare background, even though I'm not in healthcare. I'm really weird, okay? I love the human body. I've studied it all through high school and college. I was a massage therapist, a good one that you really have to go through anatomy and physiology and do the whole thing and actually look at the bone and say, that's where it attaches, the whole kit and caboodle. So I have a little bit more of a background than maybe the average person does. I would say that he didn't explain it well enough at all. Just saying.
That's a huge problem that stems out of it.
Well, and I felt like I got more from going to the COPD Foundation website than I ever did from any physician. And yes, it's a whole different, technique of learning. But from there, I went over to the Alpha One Foundation and found out even more information, because I am a person that wants to know all that stuff. The Ninja Nerds, have you guys ever watched the Ninja Nerds? Okay, so I've seen the whole pulmonology, Ninja Nerds, taking notes, the whole thing. I think I can pass your test. I swear to God.
I have for our
Well, that's a really good point, is that maybe if the provider didn't have time to go into it and
Here's some places to go and things to look at.
yeah, give you something.
And also,
for you to do.
because COPD Foundation is a group situation, there's a great 360 social on the COPD Foundation website. It's fantastic. Brand new people who just found out that they have COPD, and I was one of them. Oh my God, I just found out I have COPD. I don't really understand all this stuff yet, but I do. And people are there saying, it's okay, we're here. I've had it for 20 years. You're not going to die tomorrow. You get that kind of feedback. So at the very least, provide your patient with some resources where if they want to do their own study, it's there. I'm going to do it anyway, but not everybody does.
And some people are just so overwhelmed, they don't know where to start.
Absolutely. And I don't know where to stop.
Yeah.
We were talking about ADHD.
Yes, I'm seeing it. Kathy also is the Seattle Alpha One support group leader. She just signed up to start that, so.
And then I found out I have to do a hip replacement, so I had to cancel the first meeting.
But she's the ideal patient, because when she finds something out, she jumps in with like both feet.
I do, there is that.
And first.
It's not always a good thing, but I do.
But she does, and so, and I think you're pretty, we'll come back, and that's another really good thing. If you have a good relationship with your patients, then they'll come back to you and say, hey, I found this out, because you did go back to your pulmonologist and say, hey,
yep,
look at this test, what do you think?
Yep.
And then, but not everybody's like that. Not everybody feels comfortable right off the bat saying,
Well, I do not have any issues, I know this will shock you, with saying, hey, what's going on? I don't have any problem being an advocate for myself and for other people. But not everybody is that way. And as a peer group mentor, that's what I'm finding is there are people that just, say, well, I went once and I didn't feel good about pulmonary rehab. And I said, why not? Well, they put me on the thing and I didn't like it. And I said, well, it's okay to say, hey, I don't like this. And they go, well, I thought we had to do it. But no, let me explain. These are some things you can do. But without anybody telling you that, they're like, okay, I'm not going to go to pulmonary rehab because I can't stand getting on the bicycle, No, you can go ahead and get on the rowing machine instead. That's okay, because it's going to be doing the same things that we want you to do as far as all the stuff with pulmonary. But people don't know that, and they don't know how to advocate for themselves in a medical situation. They're looking at you as the experts, and they're like, like that.
Well, I think a lot of patients are intimidated by their doctors.
Yes.
Because they have been so educated, and you're not as educated as they are
Yes.
for the average person.
Right, absolutely.
And I think that's a lot of it.
Well, my
And
sisters
the biggest thing is
have it.
don't imitate or intimidate your patients, because then they're not going to ask questions because they're just so overwhelmed to start with.
Shut down.
That's a big thing. And listen to them. I've lost my wife has lost quite a few doctors over the years because they don't listen to the patient, and I fire them. They can't quit, but that doesn't mean you can't fire them. Listen to your patient and their families, because they do know a lot more than you realize.
That's absolutely true.
And I don't say a whole lot about it. I just kind of sit back. I mean, I'm a smart ass, and I give Audrey a bad time and have now for a year and a half. But it's all in fun.
Mhm.
And I have an awesome pulmonologist. And I've seen the same pulmonologist for a year and a half. Not a PA, not a nurse practitioner, but the same pulmonologist. I've been to a cardiologist, or I've been to the electrophysiology 4 times, and I've seen 3 different doctors. Not a fan of them. And I gave them a what for a day. Not happening.
So
If I can't see the same provider, I ain't coming back.
the consistency, because you want to build that relationship with that person.
They need to know my history. For me, it's not a big deal because my history is 2 years old. For my wife's, it's like 30 years old and like that. You cannot go through all of that in a week's time. You cannot go through it, so you're not going to know nothing.
Yeah.
Yeah, that's where you have to rely on their families that has this history and listen to them. Don't assume you know it all because you have A through Z. But what about pre-A and after Z? You don't have any history there. They teach you on textbook, but what if they're not textbook?
It's one thing they always say in our school, no patient's coming in textbook patient. Everyone's got a quirk. No one's presenting the same way. So be open to everything.
Yeah, well, I've met a lot of textbook doctors.
There's the problem.
And I have proved a lot of them wrong, and I have fired a lot of them. Because I guarantee you, my wife is not textbook.
And somebody who's had 30 years worth of medical problems probably is more than that.
I've been with her 50 years, and it's been a problem from day one.
Oh, gosh. So she's a complicated lady.
Yes.
Yeah.
As her doctor said, unique.
Yeah. That's nice.
Donate your body to science.
Yeah.
But she's going to live to be 100 by God, so. by then it's not gonna do any good.
Well, she's got a good support system.
Yeah.
So what I'm also hearing from you is that for patients to be encouraged to bring a family member who can, corroborate their story or chime in if you're not remembering something right away, then your daughter could say, oh, no, it was like this.
Bless her soul, I have a daughter that looks out for me and my wife.
She's awesome.
She's almost always here every time too. She's amazing.
She'd be here today if she wasn't home taking care of her mom.
Yep.
That just got out of the hospital. But I had a doctor once tell me that I was right, the doctor was wrong. Stick to your grounds. And I did, and God forbid, he created a monster because I was the one always intimidated by doctors. I'm a high school dropout. I don't know nothing because I'm a dropout. Well, I've had a lot of years of experience.
Your body.
And I've lived a really good, healthy life without many problems. COPD does kind of kick in the butt.
Yeah.
Big time. It like slams the brakes on you. So, but just paying attention to your patients, the ones that can visually or express themselves. My wife has a thought process issue since they put her on OxyContin in 2002. She was on it for like 6 months. She was talking to her father that had been dead for 25 years and just totally incoherent. And she relapses every time she has anesthesia. It does this to her. And her memory has never came back to what it was. She had a really better memory than I did, but not anymore.
I've never even heard of that.
What's that?
I never even heard of that.
OxyContin?
No, that it could affect your memory.
Oh, well, that and Cadian do the same thing to her. It's like,
I can't take any of those, so it doesn't make any difference, but I just had never heard it before.
I won't take either one of those because of what it's done to her. Some of the other, they don't bother me. And she can turn around and go on morphine, does not affect her. She can walk and talk like a normal human being. On OxyContin or Cadian, she's like a severe drunk.
See,
I
I'm
mean,
a severe drunk
severe.
on anything like
Well,
that.
that's-
I can't take it. I'm totally whacked up.
That's Angie. She can't take anything. But I think in part that's because her mom has gone clear over the edge. She needed something. They just didn't go about it the right way. Did they, is it they didn't know? Well, as I found out later on, is best talk to your pharmacist because they know more about medications than any doctor ever thought of.
Yeah.
Because the
Natural
doctor only
resources.
spends, he explained it, now he was old, 1 day on pharmaceuticals. That's all they spend.
That's a great tip.
You guys get more than that, right?
Oh, yeah.
Now,
We do definitely
He-
the pharmacist.
he passed away here like 5 years ago, and he was 94. He
Wow.
retired when he was 89.
Oh, my gosh. 5 years.
Hey.
of retirement.
Did a lot of his schooling in Canada. I can't remember exactly where, but did that have something to do with it? Was it the time had something to do with it? I don't know.
Could've been.
He was an awesome family physician for 30 some odd years for my wife. I only saw him when I took her because honestly, I didn't go to doctors.
Yeah.
I didn't have to. I was healthy.
And your focus was on her.
Yeah.
So taking somebody with you, making sure that you are not intimidated by your doctor and you're having an equal conversation.
Talk to them, don't talk down to them.
Right. Yes, good.
and I would agree with stick to your guns. My story is my mom, her first husband, went into the ER back in the 80s, complaining of a headache. And they just ruled it off as, oh, you just have a headache. It's a migraine. It'll go away. Here's your discharge. Go back home. And it turns out that this was like the worst headache he'd ever had. And my mom was trying to be an advocate for him, but none of the doctors would listen. Turns out that he died of a brain aneurysm the next day. And yeah.
My first husband died of a brain aneurysm. Same thing. Really bad headache.
So we receive all this education. I truly believe that you can't discount your patients when they are telling you, hey, something is wrong and this is not like me, and I want your help to help me figure out why. And you have to just kind of write these things off as, oh, well, it wouldn't have made a difference if I did it or not. Or, oh, I'm just going to dismiss you just because of your background and who you are. I'm not going to listen to you. I think I know better. No, absolutely not. And I'm sorry that you had to encounter those kinds of situations with those kinds of people. And I hope that these stories are not just blowing smoke up each other's bloods. Pardon my French.
Oh, no.
We're not politically correct. I get that, Dawn. At least I'm not.
Yeah, definitely not. Oh, but I mean, yeah, we're human beings. We have been around for, at least I hope so.
Absolutely. Absolutely.
And yeah,
Neither are we.
you guys are the subject matter experts on what's going on in your life. And it's our due diligence to figure out why and what's going on.
Well, I don't want to interrupt you, but I do want to add just a quick note here.
Go.
With that statement, is when I went to my physician because my hip hurt, and she said, well, let's go ahead and take an x-ray, and they did, and she goes, well, it just looks like some mild arthritis, and I said, no, it's not. I said, because the pain that comes is just like the stuff that I used to get in my ankle, and I had avascular necrosis in my ankle. It had to be fused. And she goes, well, okay, I'll send you to a specialist then. But her whole attitude was, here she goes again, right? Avascular necrosis in my hip. Yep. They did that.
Almost like,
They did the scan, and I'm like, I wanted to write back,
I told you so.
I know my body.
What does your current pulmonologist do that you appreciate so much or something like that?
Say that?
You said you really like your current pulmonologist.
Oh, I absolutely love it.
What
Who
is
is it, by the way? Who is it, by the way?
we're gonna plug him for the live stream.
Mine is Dr. Sasso. I already know.
Yeah. Sassy.
My wife's was Dr. Linderman, who treated her in ICU last week. And Angie just absolutely hates him. And Dr. Wiley just, nope. Why couldn't Dr. Sasso be on call? Because little did we know, most pulmonologist doctors actually are on call for critical care.
That's how it works here.
Weeks.
Yeah.
And I had no clue.
Cut out.
I couldn't figure out, and it always pissed me off, well, why is he only in clinic one day a week?
Yeah.
And it's like, Jesus Christ, I should have become a doctor. I only have to work one day. Oh, work in the hospital. Yeah, you don't work in the hospital. Well, oh, yes, you do. All new respect for him.
So you
So-
love Dr. Sasso because as we call him Sassy Sasso, he matches your energy.
Well, and I just got really lucky to get him. Dr. Troy Johnson who I know Audrey knows as well,
He's a
was
hospitalist.
my attending when I was admitted. And he brought him in, and he was phenomenal, still is. Lucky for me, my wife had him the last 5 days up there.
Yeah, that's good.
Yeah.
It is lucky.
Angie said, I thought I knew him. I said, well, yeah, he's the one that treated me when I was in. You don't remember? What I didn't realize is he went to school in Barbados, over in the Caribbean. See, I do my homework on the doctors that are treating me or my family.
They're all
I
thinking.
know where they went to school.
Yeah.
Once I got your name, good old Google, you can find out anything about anybody.
Yeah, we don't have like a really good sample size here because we've got two really involved
Yeah.
patients who are gonna get to the bottom of it.
No, I'm not really involved. In fact, I will throw this in. I do not have any kind of medical background, but, and that's a big but, my father owned, operated, and administered hospitals in Washington, Idaho, and Montana. A 350-bed nursing home in Seattle, a 250-bed nursing home in Butte, Montana, and St. Luke's has, at some point, purchased the one we built here in Boise back in 1960. It's down off Washington between 3rd and 4th. I don't know what they use it for now, but
That Cosm?
Maybe.
for what?
Could be Cosm. The ortho surgery center now.
I
Just
have no
remodeled it.
clue. I just know it's still standing because I drove by there today.
Yeah.
Because I was down at my cardiologist.
Yeah.
That's what actually brought me to Boise, was that one, which was the second nursing home in Boise.
Dr. Sassel, is he good at explaining what's going on, or just including you in everything, or what is it about him that?
Dr. Sassel, he's never in a hurry to push you out the door. He listens to you. He answers all the questions to the best of his ability. And the one thing I've only heard out of very few doctors, I don't know. That's a good question, and I'll find out. The first time I ever heard that was 5 years ago at the University of Utah when my wife was life-flighted down there. St. Luke's told us to take her home, keep her comfortable till she passes. My daughter went ballistic.
Surprising.
Made her life flight her to Utah. We caught a 5 o'clock flight to Utah and got there just in time when my flight finally showed up with her. And we spent 9 months living out of hotels in Utah.
Wow.
So we became doctors' worst nightmares, facilities' worst nightmares. Because we made them toe blind. We had nothing to do but take care of her and her medical. Yeah, we were adamant about what they could not do and how they were gonna treat her. We had nurses in the facilities, let her just lay in her own bowel movements. Well, just put it in your drawers, we'll clean it up in an hour or so. Unacceptable. Unacceptable. You have bowel movement, that nurse or nurses, they better get their ass in there and get them cleaned up now. You don't leave them like. That came from nurses when we went for follow-up appointments and were bitching about what was happening. And they looked at us like, are you kidding? That is absolutely not okay. So some of the best experience with doctors I've ever had was at University of Utah. And I met half a dozen of them down there along with nurses, and they were the most phenomenal bunch you'll ever meet. And we did follow-ups down there for 3 years, every other month. Transported her down there, went to the appointments, phenomenal. And I'm finding some of those doctors around here. Dr. Sasso's one of them. Dr. Johnson's one of them. My cardiologist is one of them. I don't get to see her very often because I end up seeing the PA, but I'm okay with their PA. I like to see the same doctor because it's easier for them to remember and stay on top of it.
Yeah.
But like I said, my pile of documents is like this. So I'm easy.
Yeah.
And I'm not afraid to tell the doctor what I think.
It's good.
So that's what I got to say on it. Now it's up to you guys to do your job. Finish school, pay attention.
And if COVID ever gets that bad again, I'm just gonna say in advance, thank you very much for all your service. Because you guys, I know the whole medical field, especially pulmonologists, have had a hell of a time. I don't think you'll evolve pulmonologists, I really don't. But, you know, I know that they've been through hell. I do know that for a fact, so.
I don't think it's just pulmonology that's short on doctors. I think it's the entire medical field. But that's right, Idaho opened up and welcomed everybody in.
Yeah, there's definitely a shortage of doctors, and I have seen that a lot. I've seen so, maybe because I'm always here, but in general, because I've lived in different states, I've seen a